Dr. Alan Tenczar, who you met in the video, is just going to say just a few words to you as a clinically, conventionally licensed healthcare provider in terms of how using perception can be merged with a conventional medical approach. But as we go through the weekend, we got some action video of Dr. Tenczar in his office where you're going to see that he goes well beyond conventional borders in how he works with his patients. So I'd like to introduce Dr. Tenczar.
Good morning, folks.
Morning.
Good morning. And I first have to express my gratitude to John for having the gift and the gratitude that he has the ability to share his gift, and that it's not something that you have to worry about. You will learn it as you use it. It's definitely a learnable technique. You don't need to have the woo-woo, the tech, you don't need to be a first-rate psychic for this to work for you, because it's very obvious. All he's going to show you is what's in front of your eyes, and it's been there all along. Maybe you never knew that there was a little sandy shore to your beach in front of the house, or there are the nuances that are there. As we go along through every day, you start to see things, and then gradually, as you become more familiar with the area, then new things open up. If you drive the same route every day, how often do you find, oh, there's a new business over there that was there all along? It's right there in front of you. So you're going to have an interesting weekend here, and enjoy it. You're not going to get everything right away, but that's all right. It takes practice. I didn't learn it right away, but I use it in the office, and I use it to kind of coordinate with what my patients are doing. Now, I don't treat gallbladder issues. I don't necessarily treat digestive issues, or I don't necessarily treat a lot of things, but I see people coming in. I see a lot of diabetics. I see a lot of people who say, no, I'm not a diabetic, with this fulminant diabetic indicator, or things like that. And so I can use what I know and what I can see to help them to address certain issues, or to look at things in their lives a certain way. And that's a large part of what I do. I'm here to, as a doctor, I'm here to teach them, to get them to take care of themselves a lot better. But I'm not, again, I can't really do everything. But I do know that much of diabetes and much of the health of that foot that's on the bottom of that person has to do with nutrition. So I do work a lot with nutrition. And then in some cases, people who do not have gallbladders, I'll recommend that they have a little digestive aid to help them so that they can absorb fats. Fats are so important, and just general health. So I'll do things like that. And with John, with his technique, it just gets incorporated into the whole, as you'll see that for yourselves here this weekend. So thank you, John, for being here. Thank you, the Infinity Institute, for having him and for having all of us. And thank you, folks, for your willingness to learn. You'll appreciate it.